Hello, welcome to this presentation on Ostracism Asian Canadian Physician Trainees Face. My name is Seti, and I am a second-year medical student at Schulich. On behalf of my team, I am delighted to share our findings with you. To quickly summarize today's talk, I will begin by giving a background on why I asked this question. Then I'll talk about how I went about answering this question, and lastly, the major themes I gathered from the study. To start, I want to give a brief overview on what is currently known in the literature about ostracism. Ostracism, defined as being ignored or excluded, has been proven to have negative psychological effects on individuals. Irrespective of its source, ostracism results in negative reactions such as sadness and anger. In fact, it causes social pain as it activates the dorsal anterior cingulate cortex, the area of the brain activated in physical pain. Asians in North America are vulnerable to ostracism. There is a common stereotype associated with Asians. They are viewed as being intelligent, ambitious, and hardworking. But along with those positive traits are the negative stereotypes: having poor social skills, shy, nerdy, and cunning. These stereotypes send an underlying message that Asians are different. There are many American studies highlighting Asian ostracism, but to date, not many Canadian studies. However, Paget et al. Studied the model minority stereotype in Canada and found it does exist. One of the key takeaways from his study was the prevalence of stereotyping and ostracism in professional academic settings. This means that fields such as medicine are more prone to ostracism. However, there was a gap in literature. To date, there has been no ostracism study conducted in Asian Canadian physicians. Based on the previous points made, our team was convinced ostracism does exist for Asian Canadian physicians. The question was how? And that is how we arrived at our research question. Our research question was, how do Asian Canadian physician trainees experience ostracism from different sources? To answer this question, I conducted a semi-structured, open-ended interview with Asian Canadian medical trainees from various departments. The interviews were then transcribed and coded for a thematic analysis building upon the need-threat model. According to the need-threat model, a model established by Kipling-Williams, there are 4 stages of ostracism: the detection of ostracism, the reflexive stage, which is the immediate reaction, the reflective stage, which is after some time has passed, and resignation stage. This is if ostracism episodes persist over time. And within these stages, the 4 psychological needs, belonging, self-esteem, control, and sense of meaningful existence, can be threatened. From conducting this interview, we were able to build upon this pre-existing model. Below are the major themes of how Asian Canadian physician trainees experienced ostracism in the clinical setting. One of the major themes we heard from the interviews were the underlying root causes that led to ostracism. The 2 biggest sources mentioned were systemic racism and hierarchy in medicine. These causes made it harder to expect change and initiate change, as it was a deeply rooted issue. Moving on to aggravating factors. Some of the aggravating factors of ostracism mentioned by interviewees were cultural differences. For example, Asian culture is typically more timid, shy, and quiet. Interviewees commented how this could exacerbate ostracism because this prevents them from joining in on conversations and feeling included. In addition, growing up with different interests and hobbies also contributed to Asians feeling out of place or different. These experiences made them feel not Canadian enough. Another aggravating factor mentioned was the lack of worldliness or diversity. Many trainees described incidents of racism and ostracism in rural areas where the ostracizers made inappropriate comments with no ill intentions. It was just a lack of worldliness. And this all pointed back to systemic racism and white supremacy, one of the underlying causes of ostracism. Some of the alleviating factors included support. When asked how they recovered from experiences of ostracism, most reported seeking support, whether that was from friends, families, coworkers, or supervisors. Seeking support was one of the biggest methods of coping. Another theme that came up was cultural assimilation. After a few years of being in a specific community, individuals learned to make small talk with Caucasian people and fit in with the crowd. Change was also brought up by a few people. One of the changes that have been happening is increased diversity in the medical cohort. Medical residents and students report seeing more racial backgrounds in their program, and this helped alleviate feelings of exclusion. Negative post-ostracism sentiments. Now we're moving on to the reflexive stage. Some of the commonly reported negative emotions soon after an ostracism event were anger, sadness, disappointment, and discomfort. Ostracism can threaten psychological needs according to this model. In this interview, we saw ostracism affecting residents specifically in these three needs. 1, belonging. The aforementioned cultural differences and exclusion from conversations made interviewees feel different and out of place. It threatened their sense of belonging. 2, self-esteem. Ostracism can be abrupt and is usually not followed by any sort of explanation. This makes one question and ruminate over the experience, and it can lead to self-blame. 3, control. Ostracism is unilateral. For example, being ignored or not being acknowledged is not something one can argue against. This one-sided experience takes away control from the victim. This was mentioned by interviewees, especially more so because of the hierarchy in medicine. The main responses seen in responding to ostracism are listed below. Many residents passed off the experience either because they weren't sure if it was intentional or they were too busy and had other things to do. Sometimes, though rare, certain individuals would try to confront the ostracizer. Some mentioned if it were obviously ill-intentioned, they would do something about it. Many reported seeking support from others, and this was an important part of recovering. And there was also this response of passive acceptance and normalization of ostracism, which can then lead to the resignation stage. So in conclusion, there are three main takeaway points. Ostracism impacts medical trainees. It leads to questioning self and feeling different. If nothing is done about ostracism, many more medical trainees who are already overburdened and overworked will undergo self-doubt and feeling out of place. 2, systemic racism and hierarchy in medicine perpetuates ostracism and makes it resistant to change. This underlying root cause makes it harder to bring about change in this problem. And 3, ostracism, specifically in an Asian context, needs to be recognized as a problem in medicine. This is the first and next step. Currently, ostracism in an Asian context is poorly understood in Canada. Recognizing the depth of the problem and how it manifests is an important step in advocating for something to be done. I hope that this short presentation has convinced you of the importance in understanding ostracism Asian Canadian physicians face. It exists and it negatively affects already vulnerable individuals. This is an understudied problem that needs more recognition and attention. Thank you for listening.